when you assess this test, first of all, you have to check presence of some specific symptoms. Look at indicators from muscular fibers. From muscular fibers up to starch. These connections are connections which show us digestion, digestive function of intestine, pancreas, liver, and other problems. So, muscular fibers. In normal situation, they have to be digested. Digested or without striated pattern. If you will see undigested fibers or fibers with striated patterns, patient has problems with proteins digestion. This symptom is named creatorrhea. Creatorrhea. First part like word creatinine. Creatorrhea. Abnormal digestion of muscular fibers. Presence of undigested muscular fibers. Connective tissue normally is absent too. Presence of connective tissue does not have special name, but it will together with muscular fibers. Next one, fatty acids. Normally fatty acids are absent in the stool. If they are present, it is steatorrhea. Steatorrhea.
Doctor, can you write those names?
I can make mistakes.
On the here.
Steatorrhea. And next one, vegetable cellulose. Vegetable cellulose could be of two types, digestible and indigestible. Digestible cellulose have to be digested and fully absorbed, and it should be absent. Indigestible cannot be digested, that's why it could be present in normal situation. Next indicator is starch. Starch have to be absent. Presence of digestible cellulose and or starch is named amylorrhea. So these three symptoms show us abnormal digestion. Abnormal digestion we can find due to dyspepsia. Dyspepsia is syndrome, and there are two syndromes of intestinal dyspepsia which we can find in this test. First one is putrid dyspepsia, second one is fermentative dyspepsia. Putrid dyspepsia. In putrid dyspepsia, stool color is stool is liquid or semi-liquid. Shape is unformed. pH is alkaline. Smell is putrid. And there is creatorrhea.
Excuse me, doctor, what did you say? Shape?
Shape is unformed.
I will.
Putrid dyspepsia is abnormal digestion of proteins, muscular fibers, and it could be caused by intestinal disorders or pancreas disorder. Next one, fermentative dyspepsia or enzymatic dyspepsia. We can see liquid or semi-liquid stool, shape is unformed, pH is acidic, smell is acidic, and there is amyloreia. Also, using this test, we can suspect some diseases. To suspect diseases, we need to assess everything and try to make summary. First disease which we can find is enteritis, inflammation of small intestine. In enteritis, patient has diarrhea, so stool is liquid, foamy, shape is unformed. In same time, we can see putrid or fermentative dyspepsia. And in microscopy, we will see white blood cells only. If patient has colitis, inflammation of large intestine, colon, patient can have diarrhea, so it's liquid, semi-liquid stool, unformed stool. In microscopy, we will see a lot of white blood cells and mucus and or red blood cells. Colitis, if it is bacterial one, can be caused by Escherichia coli, Shigella, Salmonella, which are invasive bacteria. And when they invade to epithelium, they damage epithelium and red blood cells will go to the feces. That's why we can see signs of bleeding. Also, there are diseases like Crohn's disease and ulcerative colitis. They have bleedings too, colon bleedings, and that's why in colitis we will see white blood cells plus red blood cells. And also we can find mucus, like a sign of bacterial inflammation. Next disease which we can find is bleeding. Bleedings could be of three types. It could be upper bleeding, lower bleeding, and rectal one. Upper bleeding is bleeding from the stomach or duodenum due to ulcer of stomach, ulcer of duodenum, or bleeding from the esophageal veins. In this case, patient's stool is black. The symptom is named melena. So color is black or melena. Hidden blood is positive, and in microscopy we can see red blood cells. Lower bleeding from the intestines or colon. In patient's color, you can see red inclusions. Stool with red inclusions, bloody inclusions. Hidden blood is positive. Red blood cells are increased. And rectal bleeding. The there are drops of blood on the surface of feces. Hidden blood is positive, red blood cells are increased.
What is hidden blood?
Hidden blood is qualitative test to check is the blood or not. Red blood cells are exact indicators. Hidden blood test is mostly to check presence of hemoglobin. It could be a Geiger-Sen reaction, it could be an immune reaction to detect hemoglobin. So, is it clear with bleeding? So, upper bleeding is melena, lower bleeding is inclusions in the feces, rectal bleeding is blood on the surface. Another tests are same, hidden blood plus red blood cells are increased. And bleeding could be because of colitis, so we will see also white blood cells, and everything will be like in colitis. Bleeding could be due to tumor. If there is no elevation of white blood cells, there is nothing more, and bleeding is lower or rectal one. And we can suspect tumor, first of all. We need to examine patients in presence of tumors. And bleeding could be due to hemorrhoid. Also, bleeding could be because of Hill-Means. Last indicator in our tables is Hill-Means. If there are Hill-Means or protozoa, bleeding could be caused by them. And one more disease which we can suspect, not disease, syndrome, mechanical jaundice. Mechanical jaundice or obstructive jaundice. In mechanical jaundice, bilirubin cannot go through feces. That's why stercobilin will not be produced, and feces will not get brown color. Feces are colorless or pale or white. In mechanical jaundice, bile do not go to intestines. That's why digestion of fats will be abnormal. Patient will have steatorrhea. So steatorrhea and colorless feces or pale feces is sign of mechanical jaundice. Who is absent?
Nadia.
Soma. Yes, sir.
Mucus in microscopy. Syndrome is putrid dyspepsia and disease is colitis. Okay. Let's read another card.
And Dr. Here also same like consistency is semi-liquid, shape unformed, color is brown, and reaction is alkaline, smell is putrid, and leukocyte is present, and then mucous epithelium is also present. So there should be putrid dyspepsia.
But colitis and pruritus.
This creatoria is also because under this fiber.
Yeah. Creatoria is part of putrid dyspepsia. Okay. What about disease?
Same.
Same disease, colitis. Why? Microscope. What is a microscope?
Leukocyte is present.
Leukocytes are there, and
And
what?
mucus.
Mucus is present.
It's 1 to 2 inside.
1 to 2, not too much. So if it would be bigger, it would be colitis. now we can conclude enteritis.
So like if the mucous epithelium is like it's in high level, that is colitis.
Yeah, yeah,
Low level mean enteritis.
yeah. So,
It's acidic and there is amyloria. So it will be enzymatic dyspepsia. And leukocytes present 1 to 2. And liquid unformed, that will be enteritis.
Stool is liquid or semi-liquid, pH is acidic, smell is acidic, and there is amyloria, so it is fermentative dyspepsia, and there is mucus present, and there is WBC present, so it is enteritis, and there is helminthes present, so bleeding is present.
so it's not, wait, mucus and
That is colitis.
WBC, it is
Colitis.
colitis. Do somebody have mechanical jaundice?
Excuse me, doctor, if red blood cells are absent, can it still be colitis?
Yeah, mucus or red blood cells plus white blood cells. Do somebody have mechanical jaundice?
No. Doctor, if it is
Mechanical jaundice.
0 to 1, it's negligible.
It's practically normal. So, consistency is formed, shape is cylindric, color is colorless, pH is slightly alkaline, smell is normal, blood is absent, fatty acids are present, it's steatorrhea, and other things are normal. It is mechanical jaundice, colorless plus steatorrhea. Do somebody have stomach bleeding?
Blood present.
It's in my chart too. Milena, presence of hidden blood and red blood
Erythrocytes,
cells.
right? Yeah, I have.
Yeah.
Consistency formed, shape cylindrical, color brown, reaction alkaline, smell fecal, hidden blood present, muscular fibers, digested fibers 2 to 3 in site, without strained pattern. Connective tissue absent, fatty acid present, vegetable cellulose digestible absent, indigestible 1 to 2 in site, starch absent, iodonophil flora absent, erythrocytes present, 4 to 6 in site, helmet eggs absent.
What is color? Which kind
Brown.
of color?
Brown color, normal,
Brown color without anything more, yeah?
brown.
So there is hidden blood and
And
erythrocytes only.
erythrocytes.
And the granule visible occlusions, there is nothing. We have to suspect cancer.
Cancer?
Yeah.
Because all is normal, but there is blood and
But there is blood
erythrocyte, yeah.
and we does not see source of blood.
And doctor, this one, consistency semi-liquid, color brown, reaction alkaline, smell putrid, hidden blood present, so putrid dyspepsia. Muscular fibers, undigested fibers 6 to 8 with striated patterns, so creatophria. Fatty acid present, so steatorrhea. Erythrocytes 4 to 6 and helminthes egg present.
So, is right a white blood cell?
White blood cells 0 to 1, mucus 0 to 1.
Okay, so there is putrid dyspepsia and
Hel-
bleeding because of
helminthes
helminthes.
egg.
So what is fecal smell?
Normal.
Fecal what?
It's feces.
Doctor,
What?
muscular fibers from
Fecal
0 to
smell.
1 inside, can we take it as absorbed or will we take
It's normal.
No.
0 to 1?
English.
Lavender.
The consistency is semi-liquid form.
smell fecal.
Color dark yellow.
I mean, what's the smell that you have here?
Acidic, hidden blood
Mine is
absent.
Putrid? What's putrid?
Muscular fibers, digestive
Like,
fibers,
like
1 to 2 inside.
Uh,
Connective tissues is absent, fatty acids absent. Vegetable cellulose 6 to 8 inside. Starch is present, so amyloria. And leukocytes 10 to 12 inside. Mucous epithelium 1 to 2 inside. erythrocytes and lymphocytes are absent. Fermented dyspepsia acidic, so and colitis.
Enteritis 1 to 2 is practically normal.
Doctor, consistency form, shape cylindric, color brown, reaction slightly alkaline, smell fecal, hidden but absent. So it's putrid dyspepsia.
Smell is normal or putrid.
Smell is fecal
Fecal. But why putrid dyspepsia?
because the it's slightly alkaline. No.
Slightly alkaline is normal.
Putrid means only
Only alkaline reaction is not disease yet. So I said you, putrid dyspepsia is semi-liquid stool, alkaline reaction, putrid smell, and creatorrhea, and then front stool. Yeah. If there are most of these symptoms, yes, it is dyspepsia. If these symptoms are absent, especially creatorrhea is absent, it's not dyspepsia. Dyspepsia is abnormal digestion. So what is confusion
So it
about
should be
your test?
normal.
Patient is normal.
So the muscular fibers, we have digested fiber 0 to 1 inside, connective tissue absent, fatty acids absent, vegetable cellulose digestible absent, indigestible 0 to 1 inside, starch absent, ionophile flora absent, mucus 0 to 1 inside, leukocytes 0 to 1 inside, erythrocytes absent, helminthocytes is absent.
normal.
Everything is normal.
Normal.
Yeah. You
No,
just wanted
doctor,
to ask.
like here, the leukocyte level is like 0 to 1, right?
It's
So like how to tell it's cancer? Usually it's cancer.
Cancer no WBC.
in cancer we have blood only.
Not WBC.
Screening test for cancer of colon or intestines is test of hidden blood. Patient can do it at home, patient can do it in laboratory. This test is more advanced than just hidden blood. Patient do hidden blood, and if hidden blood is positive, patient needs to be examined in presence of cancer. White blood cells will not react if it is cancer. Not in all situations they will increase.
So, doctor, for
White blood cells will be increased if there is infection.
doctor, so indications for tumors are blood and no white blood cells.
Any blood is indication to check is a tumor or not. Anyone, even if there is colitis or something else. But if there are no another signs, more data to find cancer.
In hemorrhage, white blood cells are present in stool.
Practically no. It
How to
depends on
differentiate
reason.
tumor and hemorrhage?
There is no way to do it. Only with colonoscopy. Colonoscopy, enteroscopy, or examination of stomach gastroscopy. That's why we do this test as a screening one. We suspect tumor, like the worst disease, and next we can find additional cases. If it is infection, we see that patient has diarrhea with a lot of white blood cells plus red blood cells. We suspect colitis first of all. We treat colitis. If blood will not disappear, maybe there is a tumor.
Doctor, here in this muscle fiber, it states with striated pattern, in another one without striated pattern. What's the significance?
With striated patterns are undigested. It's abnormal. It's creatorrhea. If they are without striated patterns, it is digested. They are after digestion and they are normal. Is this test clear?
Yes.
Let's do break about 20 minutes and next we will speak about biochemicals.